Every woman deserves to feel vibrant, safe, loved, and feel her power. The Woman's Vibrancy Code podcast is here for a potent use of your time. We will cover energy, hormones, and libido with episodes that also dive into entrepreneurship, money mindset, feminine power, and much, much more. Introducing Maraya Brown, Yale and functional medicine trained women's health expert, midwife, mom, and entrepreneur.
Well, hello. Welcome back to the Women's Vibrancy Code podcast. What a fun interview that I have to repurpose for you today, all about injection therapy. And when I say injection therapy, this is not cosmetic. So we're not talking about Botox and collagen, not that kind of injection. Maybe you've heard of PRP, platelet-rich plasma, or prolotherapy. It has been pretty well known in the orthopedic world. Maybe you've heard of athletes getting PRP therapy, scenarios of people doing PRP rather than meniscus tear surgery, that kind of thing. But Dr. Duncan, who's a naturopath, talks to us about injection therapy for the goal of addressing gynecological things such as incontinence, endometriosis, pelvic pain, for women who all of a sudden are losing sensation or having a hard time reach orgasm, that kind of thing. I'm talking about injection therapy from that perspective today with Dr. Duncan. So listen up. You probably are going to want to take some notes, and hopefully you're going to learn a lot. Look forward to seeing you on the other side.
So hello to all the women out in the abyss that are potentially watching this, specifically any women who have suffered from or are currently suffering from endometriosis, pain after childbirth, incontinence, a reduction in sensation in your labial area, interstitial cystitis, for your male partners, anything with premature ejaculation, and we could go on and on and on. I've heard enough women really struggling with these topics. And I wanted to bring in Dr. McLane Duncan. I always, for some reason, want to switch his two names around.
You want to switch it,
We're going to be talking about PRP, prolotherapy, ozone therapy, prolozone therapy. If you don't know what any of those are, you're going to know by the end of this interview. And Dr. Duncan, I think, is the second male that we brought into the community. And he's a very female-centered provider. I know him personally. And an expert on this topic. I actually had the opportunity for 2 days to be in the clinic and kind of just observe him utilizing these modalities in all different areas. We generally think of it in the musculoskeletal and kind of orthopedic world, but it does cross over. So anyway, let me read his bio. Dr. Duncan is a naturopathic physician and founder of Siskiyou Vital Medicine, located in Southern Oregon. His medical approach is rooted in vitalism, a system of medicine that focuses on cure, using the body's own innate ability to heal. Dr. Duncan employs time-tested natural therapies as well as the latest medical technology to develop sustainable health plans that empower patients to take control of their health. His goals are to make complex medicine simple, reconnect people with their bodies, and teach patients the foundations of health. And for more information, you can see SiskiyouVitalMedicine.com. The link is up above. And I'll also in the comments put the Facebook and Instagram handles if you're wanting to reach out to him or the other providers that work in the clinic. They're all phenomenal. So welcome.
Thank you. Thank you for having me, Maraya.
Of course. I'm happy to have you.
Yeah, I feel so privileged to be the second male. Thank you so much.
Yeah, of course. This is a topic that feels really important to bring to women specifically because there's so many that suffer with this. All of these kind of broad spectrum of gynecological stuff.
Right.
So I guess my first question is PRP, prolotherapy, ozone therapy. Can you just give a quick kind of synopsis of what is it?
Sure. Yeah. So injection therapies in general, right? So when we talk about PRP or prolozone or prolotherapy or perineural, we're using a needle to access different parts of the body and treating various health conditions with different substances. PRP stands for platelet-rich plasma. So we're taking advantage of growth factors and cytokines, healthy cytokines within the body, and placing them in very specific areas to treat the things that you brought up earlier, whether it's, pelvic inflammatory issues, sexual dysfunction, orthopedic issues, healing issues in the skin, but generally just stimulating a healing response in the body. We also have ozone, which is an oxygen gas. It's an O3 molecule that happens to have a lot of the same healing qualities of PRP. But again, it stimulates a healing response. And most of these things that we're using, it's not really, you can't really think of them as a medication. They're actually stimulating the body's vitality. So my system of medicine, I really geared towards vitalism, where I'm trying to get the body to come to a resolution or to take care of an issue versus just covering something up with a drug or suppressing an immune response or some inflammatory response, which can be appropriate, in the right conditions or under the right circumstances. And I'm not opposed to those things. It's just that if we can get the body to resolve things on its own using natural therapies that have low side effect profiles, we tend to do much better, much safer. Patients have more long-term, outcomes or positive outcomes. And we actually make the body stronger in a way versus just kind of weakening some systems, sacrificing some systems to then serve the others. So prolotherapy, you might be familiar with, it's stimulating a healing response in tendons and ligaments using a sugar substance. We use something called perineurotherapy using an anesthetic called procaine, and that has the ability to help reset the nervous system. If there's some injury that occurs within the body, whether it's trauma from emotion, surgery, or accident, the nervous system tends to have a memory and it holds trauma, within its myelin sheath, within its structure. And procaine is a wonderful molecule to go in and sort of let that go, let the nervous system take a breath and relax and allow the healing process to take place. So I've found just through my own personal healing journey through or some orthopedic issues, I found these therapies and they were just super effective. And so I got really excited about something that really works. And I've been exploring injection therapies for about 7 years now. So I keep learning more and more every day. And through my clinical practice, I get a lot of experience in a lot of different issues with women as well as males.
Well, and I hear loud and clear that there's different routes that women can take. But often what I hear is, especially in the realm of endometriosis, interstitial cystitis, it's very rare that a woman's like, I found this. Like, I was able to go to mainstream medicine and I feel relief. Like, it's more, I've tried this surgery. I've been on medication after medication. Nobody's hearing me and I'm not getting solution. Right. Same with infertility.
Right.
And it sounds like you're seeing some pretty phenomenal results.
Yeah, and we take a whole systems approach. So there's a lot more than just the injection side of it. But, for interstitial cystitis specifically, that's a very hard condition to treat that we really don't know why that even occurs or what sets off the inflammatory environment. It could be a mechanical issue where there's mechanical stress, or it could be an infectious issue. But in any case, it's like a wildfire takes off and you can't put it out. Very difficult to treat. And conventionally, you can use lavages. You can lavage the bladder. So that means catheterization, rinsing the bladder out with steroids, anti-inflammatories. There are some herbs that seem to bring some relief, but ultimately it's a very tough condition to treat. But what we've found through the use of both ozone and something called perineural therapy, where we're treating the pelvic region and the nerves of the pelvic region, as well as using ozone within the bladder, which is an agent that is both antimicrobial as well as anti-inflammatory, we're seeing really good results with every case that I've seen has come to a complete resolution. So, women some have been through several years of just pain and cycles of inflammatory sort of cascades that they get into, like they call it a flare, like, oh, I'm flaring now. So we've had great success with that. We've taken patients who've been on cycles and cycles and cycles of antibiotics, actually being able to come off of those antibiotics. So it's really good. And I give the credit to really ozone. Ozone works amazing in that condition. For something like endometriosis, we are doing specific injections into the pelvis, and those are geared more towards letting the nervous system relax, letting normal blood flow occur, lymph drainage, nerve conduction, but also working on hormone balance and cortisol and insulin. So there's a whole host of other hormonal issues, systemic issues that have to be addressed as well. So we're kind of looking at both the acute, what's happening in the pelvis, what your experience there, but also what's going on globally within the body to allow us to get the best healing response possible.
Mm-hmm. And I know there's women going, ozone, PRP, what are all these things? We're going to get into that, as well as, wait a minute, he's in Southern Oregon, I'm not there. We're going to address that. I promise, wherever you are, there is accessibility to this stuff. It's just sometimes a little bit difficult to find. So we'll make sure to point you in the direction. The other thing I'm thinking, it's so fascinating because I actually almost joined your practice and to come in and do women's health. And I really respect the practice that you've created and the way in which this like full scope approach to people and their healthcare. And I love Beyond the Red Tent and I love the program that I've created. And so we didn't end up taking that route. And I just want to say thank you.
Of course.
And the other piece is my work is specifically with women and their energy, their hormones, and their libido. And I hear over and over again in the libido conversation, especially as women after childbirth or as they start transitioning into the chapter of menopause, having reduced sensation, suffering from vaginal dryness, all of a sudden having a harder time reaching climax. And, I've heard about O shots. I know it sounds like that's a trademarked term. So really, if you could just talk a little bit about what that is, whether it's P shots or O shots, outside of the trademark conversation.
Sure.
What is going on there? Why is it working? And also, where can women potentially access therapy if they're looking for that?
Okay. Yeah. So let's talk about PRP specifically for injections in the clitoris, which is termed as the O shot, right? So there's a organization that has coined that term. But the reason that's effective is that PRP or platelet therapy. So we're taking the platelets out of the blood, and then we're taking those platelets and injecting those into the clitoral body as well as around, the visible part of the clitoris and then the hood. So the clitoris is actually much larger than what you can actually see or that we associate with the clitoris. So there's quite a bit that's not visible, that's sort of just internal. But a lot of issues arise from trauma. So either trauma during your birth or intercourse or some sexual trauma or maybe development as a fetus. But what the PRP is geared to do is it sort of introduces growth factors within the tissue, and it's also an anti-inflammatory, but it also helps sort of calm any nervous irritation. So PRP is injected into the clitoris and into the vagina, just internally. And what that's doing is improving blood flow. It's improving nerve conduction. It's filling the tissue so the tissue becomes more plump. You get a little bit more sensation because you actually have improved blood flow and nerve conduction. So we're just bringing some attention to the area. And it's regenerative in that it helps with collagen formation. So if there's any atrophy that's occurred or any fragility in that area, it can sort of help resolve those issues. And the same is sort of true with males too. For males who are either have premature ejaculation or have no sensation with intercourse, PRP sort of has the same effect. We're releasing those growth factors, releasing those positive cytokines to then bring some vitality back into the tissue. I like to add in Procaine into my protocol. And the reason, again, is that Procaine is just such a wonderful agent to help reset the nervous system. So if there's, there's any tension held in the tissue or if there's any issue with blood flow. So if you have poor nerve conduction, you don't have really good blood flow. So we want to make sure that we're kind of approaching all of those aspects for the single injection, because let's be honest, getting a needle stuck into those areas is a little like anxiety. It gives you a little bit of anxiety, and it's not that it's very painful, but it's uncomfortable. So we want to make sure that we're doing all those things that we can to use like a synergistic effect to get the results that we're looking for, which is improved sexual experience, maybe easier to climax, maybe better hydration within the tissue. For males, stronger erection, able to last longer in an intimate encounter. But, just people are usually looking for a better quality experience, right? And I think
absolutely. And this is an intimate conversation, but it's an important conversation to have because I have lots of women coming to me asking.
Okay.
So it sounds like there's ozone, there's PRP.
Yeah, separate categories that would use for different things.
Yep.
All coming together. But generally, Procaine sort of, in my opinion, sort of fits all three buckets, whether it's PRP or ozone or just Procaine. It can fill so many different roles. So I like to use Procaine.
Yeah. And if you're finding a practitioner that is familiar with all of these, they're going to know based on what you're suffering with, what you've already tried. And sounds like, is it predominantly, what is ozone exactly? How do you describe it?
Yeah, so ozone is a gas. So we're looking at an oxygen molecule that has usually what we're breathing. Well, so what we're breathing is O2. We have two oxygen molecules. Ozone is a combination of three oxygen molecules. And so when it goes into the body, it's an oxidant. So it's creating an immune response. It's sort of like PRP in that it stimulates your body to produce more antioxidants. It also resets the NAD/NADH ratio. And if you're familiar with NAD at all, or if you're not familiar with NAD at all, it helps you produce energy in the body. So our cells are constantly using energy to do, run cellular metabolism, whether, you're the heart pumping blood or a nerve conducting a signal, you're using something called ATP. So ozone is great at helping restore the cell's ability to produce energy, which and then translates into normal cell function. So if we're talking about, a vagina or a penis losing its function, whether it's, dryness or atrophy or some pain of some sort, then if the cell's working normally, you can come to a resolution of whatever that issue might be. Ozone's also used to treat pain. So if I'm seeing somebody with pelvic issues where it has a lot, some pelvic inflammatory disease or some pain issue from traumatic childbirth, ozone's really good at helping treat pain, and we use it mostly to do so. So, there's a few different areas. And then if we're just talking about some nervous condition, like I have patients who might just have nerve damage or nerve issues. One in particular had nerve damage from giving birth, and now she has pain with intercourse. We're treating the nerves with Procaine in that instance. And usually I'll do a progression. If you don't respond to ozone or Procaine, I'll sort of go up the line, and that would be PRP or platelet-rich plasma therapy next. And then sometimes I combine all three. But it really depends on how the patient might present or the person might present to me.
I'm thinking, gosh, all the pelvic floor PTs out there, wouldn't it be great if they all became trained in this?
If they knew it was an option. I think a lot of the issue is that we don't know it's an option within our culture. It's commonly practiced in the circles where it's known, so if you know about it, like everybody does it. But if you don't know about it, you just don't hear it at all. No one's really talking about this therapy, especially if you're in the conventional side of medicine, where, insurance, maybe they're coming around now and maybe they'll start paying for more PRP, but they definitely don't recognize ozone therapy. And it's not an FDA approved therapy. That's kind of like the big disclaimer here, but man, it sure is effective clinically.
Well, and I think when I lived in Hawaii and my husband was doing the Ironman, you think of ozone therapy, a lot of high endurance athletes use it. And then I've also always heard about PRP in the context of orthopedics rather than knee replacement. And even though I had heard of these modalities, it wasn't until I was spending time in your office that you mentioned, endometriosis and infertility. What about for women who've been told their fallopian tubes are plugged? Have you worked much in the infertility world, or do you know practitioners who have?
Fallopian tubes specifically, no. And I do know practitioners in Portland that deal with those sorts of things. My approach to fertility is more nutritional and hormone balance, much like you're doing, I'm sure, looking at progesterone, estrogen levels. How are you controlling your cortisol? Are you timing your cycle? Those sorts of things. But when it gets to anatomical issues beyond like stress incontinence or incontinence, where there's might be a connective tissue problem with a ligament or a tendon. But if you're getting into malformations of a fallopian tube or there's just some anatomical issue, I don't think that the injection therapies are going to change the anatomy. Okay. You know what I mean? Unless you're talking orthopedic, then you can see improvement in osteoarthritis and, meniscus repairs and tendon repairs and ligament repairs, which the pelvic floor is, right? All ligaments and tendons. So people are like losing their capacity to hold in either their uterus or their organs or, having incontinence issues, then these injection therapies are definitely worth a try to see if they can help with that. But, to answer your questions about, anatomical problems, I'm not really sure about that.
Okay. And then in general, if a woman's going to try one of these modalities and find a practitioner, how many visits do you think is fair to expect? How many injections?
I think 3 injections is standard for like a PRP session. I know that we have members or patients of ours that, get results within 1 injection, but I hate to set that expectation, because it is a medical practice and it's hard to say, but generally I prep people for at least 3 injections. For my interstitial cystitis patients, I usually say, let's do 3 rounds of therapy, but I often get resolution within 1 to 2 treatments. But, I really want to be realistic and I'm not really sure how someone might respond to the very first injection. So it's kind of hard to say. Yeah. And there really isn't a good screening tool for how someone's body is going to mount the response. Because what I'm asking your body to do is come in and do the repair itself. We're not injecting a drug that's going to force some cascade of events. We're actually asking the immune system and the antioxidant systems and the nervous system to participate in the healing that we're looking for.
Oh, cool. And is there a certain general spacing of time between injections?
Yeah. So if you're PRP, about 6 weeks. For things that are inflammatory, I typically space the second treatment about 2 weeks out from the first. In some cases, we can be a little bit more aggressive, but generally it's about 2 weeks. And the reason is that I want to give the body some time to respond. Right. And, and as soon as I inject, and I had a good question from a patient, she's like, well, why don't we just do more ozone more frequently? And really the answer is again, it's not a drug. I'm asking the body to do something for us. And so I'm kind of waiting for that response to see what's going to happen. Is it going to be a positive experience or a negative experience? Do I need to increase my dose a little bit? Right. So.
Yeah, it's fascinating. And so then obviously for women, it sounds like no matter where they are, they can go to your website, reach out, and there's free consults. You do telehealth, but you can't do virtual injections. You could point them in a direction for the overall approach. And then where does a woman start in trying to find if there's someone in their area?
So there are a couple of ozone organizations that you can look at, and I could share the link with you and maybe you could post that to your page. But we look at Dr. Schallenberger. He's sort of a well-known ozone practitioner. He has an organization. There's also an organization called SOPMED, SOPMED. You could probably find a host ozone practitioners through that organization. And usually if someone's practicing ozone medicine, they're doing the other stuff too. It's kind of a tight-knit community. And if they're into ozone, they've already been through either the Prolo side of it, which is the sugar and the dextrose injections, or they've been through the PRP side of it too. So, the conferences that we go to and the training that we go to, it's kind of like I said, it's a tight-knit community and you get to know a lot of people. And so there are more DOs, MDs, and nurse practitioners are actually stepping into this. And so it's actually becoming a nationwide thing, where I think before it was just in certain little functional medicine pockets or in the Northwest with the naturopathic profession. But, I think it's, and I can list some things on my website as well to help people with that. We can't do virtual injections. You're right about that, but we can do second opinions. So if someone is seeing another practitioner that might be recommending a certain therapy for one of the conditions that we're talking about, or some pelvic issue in general, we can do second opinions. We can direct people to different providers that we know of in their area. We do the free 15-minute consult. So, it's kind of a no-brainer. If you have a question, just go to our website and schedule an appointment, and we can do the telehealth piece and get you pointed in the right direction. And if we can't find anybody, just hop in the car and make a road trip.
Yeah. And you
Oregon's
do
awesome, especially Southern Oregon.
It really is. It's where I am too.
Yeah, it's beautiful.
When I was starting my journey of trying to explore this and then bumped into you at the beach, it was like, I have to interview you on this. I did listen to a podcast by a gentleman in New Zealand who had practiced in Hawaii. And it sounds like Canada, Europe, New Zealand, Australia. I mean, it's really, this is well known and being utilized around the world.
Around the world. It's even more popular outside of the United States.
Yeah.
Like you just said, it's everywhere else.
Yeah.
So,
and particularly, it sounds like naturopaths were kind of the first, naturopaths and functional medicine providers, kind of the first to take it on.
Yeah, really. And a couple of MDs, you got to, like Dr. Schallenberger, he's been practicing ozone for 30 years. Mm-hmm. There's Dr. Robert Rowan, I think he's in LA. He's been doing it for decades and decades. Yeah, I mean, as naturopaths, we're generally looking for things that are natural, that are effective, and that are asking the body to do the healing for us, right? Because ultimately, we all want cure. Like, I don't want to just have to take something continuously to live my life, because really at that point, you're not free. You're attached to something. And I think that's idealistic, but, it's a goal. And I'd rather, shoot for the moon and land in the stars. I think that's how it goes.
Sounds good. What is it? Some guy just spent $28 million to go on a ride out in space.
What?
I know. Oh, the money in the world. I also have heard, I know that you don't use the trademark OSHOT, but it sounds like there's OSHOT directories too. So somebody could just go do a Google search for OSHOT directory, and that's a way to find practitioners in your area. And I imagine if they're doing OSHOTs, they'll likely also be doing the other modalities and potentially at least point you in the direction of also getting support for your interstitial cystitis and your endometriosis and your incontinence and all different modalities. True?
Yeah, I think there are kind of two sides to the OSHOT. If someone's doing an OSHOT, they're probably a little bit more conventionally trained. At least my experience, I went to a conference through the American Aesthetics group and, learned like PRP facials and PRP breast lifts and different things. And I see a lot of MD, DOs, FNPs in those courses, where in the Ozone, we're seeing more and more MDs and DOs, but generally you're seeing a lot of naturopaths. So maybe it'll be a bridge, but if you're looking for Ozone specifically, you might want to use one of the websites that will provide you one of the links to find a practitioner that way.
Got it. Good to know. I want to open up to see if there's anything that feels left unsaid. But while we're talking injections, I understand you also do vitamin C IV therapy. Mm-hmm. In the context of the gynecological world, do you also integrate anything else other than PRP, prilocaine, ozone?
Yeah. So
does
for
vitamin B then move into this?
Yeah, the IV side of it, generally we start with something called a Myers cocktail, which is a bag of vitamin C, B vitamins, minerals, amino acids. We kind of have our own spin on it. But the general concept is, let's give your body all the tools it needs to do the repairing. So if I feel that someone comes in and they're really depleted, but they need some injection therapies or they're wanting some injection therapies, I'll sort of direct them towards some of the IV nutrition that we do or the IV therapies. Vitamin C is great for collagen repair, right? You're going to need some vitamin C, probably going to need some magnesium and some of the other trace elements. So I kind of build that in, or I'll layer that into some of the treatment protocols I do. If you're 24, eat amazing, have, no issues, and you're just, full of vitality, we may not do something like that. But if you're 40, have had a few children, have some hormonal imbalances, maybe some absorption issues, that might be contributing to your issue, to the problem that you're experiencing, then we might layer something like that in. Mm-hmm. Ultimately, we want it to work, right? Like, I don't want to do an injection that doesn't work. And the reason I got into injection therapy is that I actually herniated a disc in my back, and it was very painful, and I didn't want to do the steroids and the antidepressants and the surgeries. Just looking at literature on recovery from, the injury that I had suffered, I found injections and it worked, right? So I'm like, I got to learn that. I want things in my practice that are actually going to make a difference in people's lives. So if I feel that through our conversation about injections that you could use a little bit of support through IV therapy, definitely going to throw that in there. Mm-hmm. Or, if someone needs hormone balancing, hopefully if they're coming through your website or you guys are already working on something like that. So it's multi-layered, it's multifactorial, but ultimately what we're looking for is a really positive experience that is going to be long lasting.
Yeah. And it sounds like even in the aesthetic world, like I'm not open to Botox and collagen, but it sounds like potentially PRP injected in the face, it creates some regeneration.
Absolutely. Yeah. We're asking for repair. And the way we repair those tissues is through the production of collagen. We're stimulating the fibroblasts to make more collagen. So whether it's acne scars or, wrinkles or, some other issue, we can definitely try PRP.
Yeah. So fascinating. I'm so grateful that there's practitioners like you out there really forging the way. And we get to use this platform to help women out there know that there are other solutions. Yeah. Anything that feels left unsaid that maybe I didn't ask about or we missed in the context of this?
I think most of it was covered. I do want to make sure that we're talking about when, you say prilocaine, but really it's procaine. So I just want to make that nuance. So if someone's asking for it specifically, it's PROCAINE. Again, the reason I like that is that it's sort of a natural product. It's not super toxic for the liver. It's a short duration of anesthesia. I'm not really looking for the numbing action of procaine. I'm really looking for its action on the nerve and the nerve conduction. And I think what's important to recognize is that when someone is experienced or has experienced, pain or a traumatic event, that nervous system, that memory within the nervous system can prolong some inflammatory issue, right? So we see it with chronic regional pain syndrome. Someone injures an ankle, and even though the ankle's repaired itself, there's still ankle pain. It's interesting because we've seen this with people who've had amputations and they have phantom limb pain, like they still feel the hand that's no longer there because there's this neural groove that's been created within the central nervous system, the brain and the spinal cord, that still senses that, right? And it's still giving you a phantom pain signal. So I use procaine to go in and reset something like that and let the pain signal go, clear the nerve trauma out of the tissue, which allows normal blood flow, normal lymph drainage, normal cellular metabolism. So then it gives us a better chance to achieve the healing response that we're looking for. So
cool.
Yeah.
Yeah. So ozone, PRP, meaning platelet rich, your own platelets. They literally just draw your blood, send it through a centrifuge, take the platelets. And then there's also procaine. And when you see a practitioner, they might use a mixture of all three. They might choose one, the other, and just know that there are lots of solutions out there. I mean, could you just list quickly all the different things, even outside of the gynecological world? I mean, I watched you give injections to this woman with intense scoliosis and in the knee. And I mean, it seems kind of limitless.
It really is. Yeah, we do anything from, migraine headaches to neuropathy or disc issues, disc herniations, sciatic issues, torn rotator cuffs. So a lot of orthopedic stuff, a lot of carpal tunnel. We even do some sinus injections. So people who have chronic sinusitis or chronic allergies, we can get those things to kind of clear. Dental issues. So pretty much anything that involves an inflammatory response that won't resolve or pain in the body, right? So it's I know it's nebulous. It's a huge thing. It's like when I look at ozone and the benefits of ozone, I laugh because it's really just pages and pages. You're like, what is this not good for? Yeah. And I keep telling my staff, if we had to have one therapy in our clinic, if we could only have one thing, I would definitely choose ozone because it treats so many things.
Awesome. Yeah. And any scenarios where it's like this patient population or this scenario, it's contraindicated or, this would not be a good fit for you if you XYZ.
Yes. So generally, ozone therapy is contraindicated with folks who might have heart issues, angina, or heart spasms. The other is any bleeding disorders. But generally, it's safe for about everybody. And, we can kind of run through that in the screening process. PRP seems to be pretty safe in most populations, even in people who might be weak metabolically or have some metabolic issues. And procaine, we use it in almost every case. I think that the other instance where we may not use ozone is in something that's very acute and very inflammatory when someone's antioxidant systems might be taxed already. So, ozone is a very oxidative stress, right? It's an oxidant, meaning that you're using your antioxidant systems, which we're all familiar with antioxidants, right? Blueberries are antioxidants, resveratrol is antioxidant, vitamin E is antioxidant. Like our society, our culture, exactly. Those delicious, I love those. So our culture has been informed and probably beaten to death with antioxidants, right? Get your antioxidants. It makes you younger and healthier, but really we need a little bit of oxidative stress in our lives, just like we need a little bit of just stress in our lives in general, right? So a little bit of oxidative stress can cause a healing response. But if you're already taxed, you may not be a candidate for ozone. And that's going to be something that you discuss with, your provider, or if you come into our clinic. And then one more thing is there's an enzyme that is in our blood, in our red blood cells. It's called G6PD. If you don't have that enzyme and we give you an antioxidant or an oxidant like ozone or high doses of vitamin C, then that can cause an issue. So you want to make sure you're screened for that. So if anybody out there is like, I want ozone, well, make sure you have the enzyme. And most of us do. They're just a fraction of the population that may not have that enzyme present.
Okay. So thank you again for your time. I really appreciate it. And I'm sure that there's lots of women that are just going, why did I not know about this before? So once again, his website is up there. Sounds like free 15-minute consult. Book that, have the conversation. I'm sure that either McClane or Dr. Duncan or one of his staff can point you in the direction of based on wherever you are. And like he said, a trip to Southern Oregon is beautiful.
Absolutely.
And then I'll put Facebook and Instagram handles in the comments. And with that, just want to say thank you to everybody for watching. If you're watching this before August 16th, really excited for the free workshop that's coming up. And Dr. Duncan, any last thoughts?
Other than just thank you so much for bringing what you bring. It's super important that you're doing what you're doing. So thank you so much. And thanks for having me.
Of course. Thank you.
Thank you for listening to the Woman's Vibrancy Code. Connect with us and take the first step to transforming your energy, hormones, and libido at thewomansvibrancycode.com. Cheers to your zest and vitality. Make sure to follow for weekly power-packed value.